everyone, today we are back with our lower body muscular endurance assessment. It's called the sit to stand. So you need a chair and you need a metronome for this assessment. Your metronome is going to be set to 60 beats per minute, which gives you 30 reps per minute. All right? And then after you demonstrate for the client how to do this, you'll let them do a couple practices just so they can feel the chair in space and then know where their target is. Give them a few seconds rest and then have them go. So with the muscular endurance test, you're telling them they're doing as many reps as possible. All right, so I'm going to demo it for you. Get my metronome started here. So it's up on a beat, down on a beat. And again, the stop criteria would be if your client is no longer maintaining that cadence, they're not down when it's beeping or they're not up on that next beat, maybe they're slowing down a little bit. Another stop criteria would be they're not totally getting down and they're not totally opening up their hips at the top. So you want to make sure they're maintaining that full range of motion throughout the exercise. They get 2 warnings, and then on that third one, you're going to terminate the test. So they're going as long as they can go on this one. So some things to think about here is which populations would this test be good for? It's going to be good for sedentary people, people that haven't been working out for a while, elderly populations. It could be a low intensity test for someone who maybe came off of surgery recently after they've been released from their physical therapist, of course. But for athletes and more active populations, this is not going to be challenging enough for a lower body muscular endurance test. They're gonna do 400 or 500 reps before they get bored. So think about that when you're trying to assess lower body muscular endurance for your athlete or your client, anyone. Just make sure that it's appropriate for your client. Otherwise, there's no point on implementing the test and wasting your time or your client's time. So make sure you know your population and that this is gonna be good for them. Of course, you might have your client do this and they might get in the hundreds of reps and you realize at that point, wow, they have a lot better lower muscular endurance than I thought that they would. That's totally fine. You can just kind of throw that out for the post-test and then maybe implement something else. This is all a learning process. You're never gonna get it 100% right the first time, so be gracious to yourself. So I'm gonna show you guys this again real quick. All right, here we go. Okay, make sure you count your reps for your client. If you have a timer out, that will kind of help keep you honest. Like, okay, they've been doing it a minute, which means they got 30 reps. But you don't want to have to break down how many seconds with the reps and everything. Did they maybe do 4 or 5? I don't know. So it's best for you if you just count out loud for your client. Again, when there's a metronome, make sure not to be counting or coaching too much volume, too much intensity over what you guys are doing for your metronome. You want them to be able to hear the metronome, so don't get too distracted. If you have to count with your fingers, that's totally fine. Maybe let them know every time that they hit a 10 or a 20 or a 30. Just kind of keep them in the loop on that. All right, guys, there you have it, sit to stand assessment.